Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Zamfara state government takes the Astrazeneca campaign to soldiers to bolster confidence in the vaccine. In Taraba State, government affirms safety of Astrazeneca vaccines, encourage citizens to take the jab. And Brazil COVID-19 deaths surpass 300,000 as hospitals run out of ICU beds. The Nigeria Center for Disease Control, NCDC, confirmed 96 new COVID-19 infections. The new figure, another low in the daily figures this year, puts total infections at 162,178. The new cases are reported from 15 states, with Lagos recording 28 new cases, Yobe and Akwa Ibom with 20 and 10 new cases respectively, and some of the other states, as you can see. According to health authorities, there were no deaths recorded from COVID-19 related ailments. An additional 196 discharge cases were recorded, the lowest so far this week, as 405 were discharged in the previous 24-hour cycle. According to the agency, the discharges today also include 73 community recoveries in Akwa Ibom State and 20 in Lagos State, managed in line with the guidelines. This now puts the total number of those that have recovered in the country to 148,726. According to the National Primary Healthcare Development Agency, so far, over 325,000 Nigerians have been vaccinated with the first dose of the COVID-19 vaccine as of today, representing 8.3%. A look at the breakdown of the state shows Bauchi, Jigawa, Yobe, Osun, Kwara states are moving ahead with vaccination, while states like Kebbi, Kogi, Zamfara and Taraba have no updates. Around the world, over 124 million confirmed cases have been recorded and more than 2.7 million deaths reported. The Lagos State government has advised residents interested in being vaccinated to pre-register for the vaccine before visiting any of the designated centers. The State Commissioner for Health, Professor Akin Abayomi, made this known when he paid an unscheduled visit to some of the centers in Lagos. He says it is mandatory to visit the COVID-19 vaccination portal in order to manage the crowd and avoid community spread of the virus in Lagos.
There are two ways of registering. You can pre-register and you get an appointment, a date and a location according to the registration portal. You go on the registration portal, you look at the 88 sites, you identify the site that is closest to you, either your home or your office. You then book a date and a time. There are 3 time slots between 8 and 10, 10 and 12, and 12 in the afternoon. So those are the 3 slots. If you cannot register, pre-register, but you want to go to a center that is close to you, one of our 88 centers, you can come there and you get registered on site. It's the same portal, except one you can access through your handphone, and the other one you access it through what we call the recorders, and these are recorders. They're recording your data and making sure that you qualify for the vaccination. And if you qualify and they enter your data and they upload your data, then you go and get your vaccination. Okay? Now the challenge has been that the pre-registration portal has been having some technical difficulties, which means that majority of people are coming to the centers without having been pre-registered and scheduled. And what we're going to say to the public is, try and pre-register and get a date, a location, and a time.
And from Lagos to Taraba State, where the Executive Secretary, Primary Healthcare Development Agency, Dr. Aminu Jaro, has reiterated the safety of the vaccine, disclosing that all needed troubleshooting for the Oxford Astrazeneca vaccines have been done at various levels. He warns that the vaccine is not in the state as a substitute for the COVID-19 safety protocols, but as a catalyst to improve residents' immune status by reducing severity.
If the vaccine is not safe, I think the number one citizen of Taraba State will not present himself for that vaccination. That is one. The second issue is whenever there is new vaccine roll out, not only in Nigeria but across the globe, most of the time there are a lot of controversy surrounding it. But I want to believe vaccines are product of science. And all efforts and element of troubleshooting that has to do with the vaccine have already been done, both at the international level and even at the arrival level in Nigeria, where NAFDAC have also took its own pen and time to ensure that it checked the vaccine that arrived into Nigeria, whether it is safe and effective. And it has also given a clean bill of health for the vaccine. Over 487 million people have so far been vaccinated with Astrazeneca coronavirus vaccine across the world. And I think that is enough justification for people to understand the fact that this vaccine is safe and is good for our body. But let's have this at the back of our mind. The vaccine is not coming as a substitute for using the face mask, stopping hand washing, and what have you know. The vaccine is coming to increase or to improve our immune status so that even if, God forbid, you come across the virus, the severity of the virus will not be so much on you, talk less of even allowing you to infect others. That is one. Two, each individual is expected to have 2 shots of the vaccine. 2 shots at an interval of 3 months after the first one. So that will go a long way in at least increasing and boosting the immune status of that individual.
Over in Zamfara State, sensitization of the safety of the Oxford Astrazeneca COVID-19 vaccine has been taken to the 1 Brigade of the Nigerian Army, Gusau. The Commissioner for Health said the sensitization is necessary to enable people to accept the coronavirus vaccine towards eradicating the pandemic in Nigeria. He said his ministry plans to carry out the public education and enlightenment efficacy, the safety of the vaccine, and the need for the citizens to receive the vaccines to protect themselves from the global health crisis.
The sensitization from Army headquarters started long ago. Personally, I got the link from the medical officer here, which I used to register time back. And I believe a lot of officers and personnel and their families have also registered. So we're just awaiting the date where we could receive our jobs. So, but due to recent development and what we talked about, we wait for the right time to have our jobs. So we want to assure you that we support your program and we'll continue to assist where necessary and continue the advocacy.
For more on the vaccination in Zamfara, the Commissioner for Health, Zamfara State, Dr. Yahaya Kanoma, joins us right now via Zoom. Thank you for joining us on the program.
Thank you, my sister. How are you?
Very well, thank you. Tell us a bit more about the reception of the 1 Brigade of the Nigerian Army to the vaccines.
Yes, actually, this morning today, I take all my team leads to the 1 base Army barrack in Gusau, just in order to make a sensitization, enlightenment, and advocacy to the military cantonments there. As I promised, as my governor, His Excellency Dr. Bello Mohamed Matola Moradum promised that he directed me to visit all the stakeholders. I started with the 1 Brigade Army, and from there I will proceed to post headquarters of police, correctional headquarters also, and national civil corps members and DSS also. I will make a visit for all is for the sensitization of this program of vaccination, as I'm directed by my governor since on Monday when I vaccinated him. He promised that he will direct me to go and visit all these stakeholders and frontliners in the state, which I did. Presently, I came to, I went to one brigade today with that purpose.
Dr. Kanoma, I mean, there's a lot of work ahead as, you know, the vaccination continues across the country, but do you foresee a problem implementing the vaccination drive and the campaigns? And this is in the face of some of the insecurity challenges bedeviling the state.
No, but with all insecurity that as people are thinking, it's not like that. I think my own governor, Dr. Bello Mohamed Motola Maradon, have tackled most of the insecurity campaign here and there. Even right from last year, with all this insecurity, he divided his mind with all this sensitization and other things. And I'm telling you that with the reconciliation process that he take with about the insecurity, even day before yesterday, when some ministers of the Federal Republic of Nigeria came to Zamfara because of negotiation, they met us with some people that was kidnapped for 49 days, but they were brought by some bandits by themselves without any shilling or a single dollar that was given to them. I'm telling you that the insecurity didn't tamper with all our process of vaccination and other things that we are doing in the state. As far as I'm concerned, and with my own governor, all measures has been taken about this insecurity, and inshallah, we are going to banish whatever it comes to our state.
So we also know that Zamfara State received about over 55,000 vaccines. The National Primary Healthcare Development Agency is putting statistics of those that have been vaccinated on a daily basis. But we see that Zamfara State has no figure on the number of vaccinations that have taken place. Why is this?
Yeah, actually, since last week, we received 55,920 doses. When you break it into vaccinated people, that you get 27,960, which we have started with the first citizen of the state, that is His Excellency Dr. Bello Mohamed Motola Maradon, and Speaker of the House of Assembly, Right Honorable Nasru Magaria, and Deputy Chief of Staff. And from there, we plug up. Then from there, even yesterday, we are in Federal Medical Center as we are directed from to vaccinate the frontliners. And we also went to Federal University, so DC and his own people that they are all vaccinated. And the other point, we went to police headquarters too to vaccinate the CP and his members. And it's a continuous process. It's not only one day that you can do that. And other stakeholders, they are coming, and every day. And you know that most of the people, some they have registered online, some they didn't register online. We do two things together or three things together. Mobilizing people, sensitizing people, enlightening people, and do the vaccination at the same time. So all our team was divided into a 14 local government approach, and they are still on. And we have no anything that we continue to explain to people how to accept that. And my own governor gave me all the what I want, transportation, other contingency things that was given to me so that I can take the job as serious as it is.
We'd like to thank you, Dr. Yahya Kanoma, Commissioner for Health, Zamfara State. We wish you all the best in the efforts to vaccinate the population. Thank you for joining us on the program.
Okay, thank you so much. I wish you.
Plateau State has started vaccinating its athletes in earnest ahead of the sports festival built to take place in Edo State. The tournament has suffered 3 postponements owing to COVID-19 pandemic amid fears of the infection getting out of control. This time, sportsmen and women are hoping the festival will hold as slated. According to the Director of Sports in the state, the number of delegates has been reduced to comply with the COVID-19 protocols.
Initially, we have 410 contingent, but due to COVID-19 protocol, and the number from the Federation has been slashed down from 14,000 to 8,000. Therefore, we on our own site here also, we have slashed our number down, the contingents. Presently, we are intending going with 260 contingent, both athletes and officials. Most of our athletes sometimes run away because of lack of illumination. You find out here, we on the plateau, we employ almost a large number of athletes on the payroll compared to other states. And when some of the athletes find out that other states, they will say, come to our state, we'll give you 500,000, 200,000, 100,000. They will rush there. But one important thing is that after the National Sports Festival, they will dump them, just like licking orange and then you throw the seal away. And not knowing that most of them that are receiving 50,000, 20,000, 30,000 every month, when they calculate it, it's more than what they have funded to receive. But thank God, some of them, when they go out and find out that it's not convenient for them, they fall back to us.
The total number of confirmed coronavirus cases in the United States has passed the 30 million mark. This is according to Johns Hopkins Coronavirus Resource Center. This is as new infections continue to trend upward in a majority of states despite the escalating vaccination campaign. As cases surge, health experts say it might be because of the rapid spread of new variants of the virus. Dion Ibeke is a medical doctor at Bloomington, Illinois in the U.S., and she joins us right now via Zoom. Finally, good to see you. Thank you for joining us on the program.
Hi, thank you for having me.
All right, Doctor, why do you think the U.S. is still recording more and more cases while it continues its vaccination drive?
Well, as you mentioned, we have new variants. And we have the UK variant, the South African variant, just to name a few. And those are more contagious and spread more rapidly. Unfortunately, we can lead to more hospitalizations. The other thing is that we've been in this pandemic for a year now, and people are having fatigue. And so, they're laxing on their public health measures like wearing a mask and social distancing. They're gathering more. They are traveling more. So that's leading to some spread of this virus. And then we've had states have premature measures that they've taken to lift mask mandates and open to full capacity. And what that does is it allows individuals to, again, become more lax on their day-to-day public health measures. It's unfortunate because Biden announced that as of May 1st, all Americans will be eligible, 16 and older, will be eligible for the vaccine. So, I just wish they could just wait a little bit longer before making those measures for their states so that, we can keep people safe and get that herd immunity that we need to get back to normal.
And, that's really the question. Is this the best time to roll back restrictions? Because, it appears a lot of people are really tired. But then last week, President Biden did talk about his plans of rolling out even more vaccinations. I mean, doubling his previous targets of 200 million doses by his 100th day in office. Do you see this happening?
Oh, I absolutely do. He originally had the goal of 100 million shots in his first 100 days. He was able to do it in 58 days. So at this rate, I definitely see him getting to the 200 million shots in 100 days. And why is that? We have ramped up production of vaccinations. Johnson & Johnson has now teamed up with Merck, thanks to the Biden administration, to increase production. And that's going to be added to what we already have with Pfizer and Moderna. We also have more vaccination sites. We've become more efficient at administering vaccines for the population. And then additionally, people are more receptive. Before Biden got into office, in November, we had about 60% of people say that they would get a vaccine. Now that number has increased to 70%. So when you combine those three factors, we'll definitely see an increase in the rate of vaccinations in the United States, which is great, which is beautiful news.
As a medical doctor, I'd like to get your thoughts on the Astrazeneca vaccine. It's pretty much been having, some would say, call it a bad press situation. The overall attitude to it in some areas, maybe like Germany, we understand some healthcare workers prefer the Pfizer-BioNTech. But what are you hearing in the US? I know it's not been approved yet for use.
Yeah, so as you mentioned, the Astrazeneca vaccine has not been approved for use in the United States. The bad press is unfortunate. It sounds like they were misleading, a little misleading in terms of the efficacy data. They were touting a 79% efficacy, but when the internal review board looked at their data, it looked like the numbers were closer to 70 to 74%. Really not that big of a difference. And 70 to 74% is actually really efficacious. That's a good vaccine. But when you have discrepancies like that, even if it's minor, that leads to distrust in the public sphere. Vaccines in general, people are hesitant to take them. So when you have bad press like this, it makes people less likely to want to get the vaccine, not just AstraZeneca, but it affects other vaccines that are already in the market. I do think that this whole story is a testament to how rigorous, the FDA and other organizations are in holding these pharmaceutical companies accountable. We don't just take them at their word. We do our due diligence to make sure that their data lines up before we ever, provide it to the public. But like I said, it does sound like that AstraZeneca is a good vaccine. They just have to iron out a few kinks.
Before we let you go, you've received your vaccine and your latest mom, congratulations. And you're also nursing your baby. So how did you make that very bold decision?
Well, for me, it wasn't a bold decision. For me, it was a common sense decision. I am a healthcare worker. I'm an anesthesiologist. I'm high risk. So for me, that vaccine was another weapon in my toolbox to fight against this disease. Every day I go to work, I'm concerned about what I could bring home to my family. And this allows me to decrease the risk of bringing this virus home. And it also, increases the risk that I'll be there to raise the children that I'm bringing into this world. The American College of Obstetrics and Gynecology, they put out a statement for pregnant and nursing mothers. And what they said was that, yes, they weren't included in the studies, but these vaccines should not be withheld from pregnant and nursing mothers. You have to do a risk-benefit analysis. We know the risk of COVID, especially with pregnant mothers. They're higher risk. They could get hospitalized and they could die. They're higher risk for all of those things. So there has to be a risk-benefit analysis. For me, I was one of my deciding factors to do this as a nursing mom was the possibility of giving some antibodies passively through my breast milk to my baby, which is just another way to protect them. And data, I'm waiting for the data, but there is a little bit that could show that I am doing just that. All I will say for pregnant and nursing moms, I understand the hesitancy. This is a very important time in your life. Make sure you have a conversation with your obstetrician, with your primary care doctor, and make it a shared decision so that you're confident in whatever choice that you make.
We appreciate your time. Thank you so much, Dr. Dion Ibeke. Thank you for joining us on the program.
Thank you for having me.
Brazil has topped 300,000 confirmed COVID-19 deaths, becoming the second country to do so amid a spike in infections that has seen the South American country report record death tolls in recent days. Just in the past 75 days, Brazil has registered 100,000 confirmed coronavirus deaths, a spike health experts blame on a lack of political coordination in fighting the virus, new variants that spread more easily, and a disregard for health protocols. President Jair Bolsonaro has consistently downplayed the severity of the pandemic, insisting the economy must be kept humming to prevent worse hardship, and he has criticized health measures imposed by local leaders. Don't forget to protect yourself. Continue to take responsibility. Visit our website for more updates, a better understanding of the pandemic, plus other stories. It's channelstv.com. Thank you for watching. I'm Millicent Nwaka. Stay healthy.